Next up is Tom Kenyon. Tom is the director of the Center for Global Health at CDC. Tom is a real hero for a lot of us. He's been involved in work on HIV and a range of global health issues for several decades now. I first met Tom, I think, in Botswana, but most recently in Ethiopia. He just recently moved to Atlanta to take over directorship of the center. Tom, thanks for joining us today.
The right one. Okay.
Oh yeah.
Thanks, Todd, and thanks to the congressional staffers, the representatives from partner companies, and the media and others for being here today on this session on diagnostics. It's actually unusual for us to have a session on diagnostics. I've been doing this for many years now, and we've had lots of sessions on therapeutics and vaccines, but never on diagnostics. And I was really pleased to be able to come here today and be with you. Let's see. There we go. So improving diagnostic tests and getting them to where they are needed, which is often underappreciated, to save lives and stop the spread of infectious diseases, that's been a big priority for our global health work at CDC for many, many years now. I could cover a lot, but what I've chosen to cover is just some developments in diagnostics around malaria, HIV, and TB, which, in spite of commendable success in all of those areas, continue to be major killers. Stay with that one. We've learned a lot from our experience overseas. The first point I want to make is that's also relevant to our public health work here domestically. A lot of the lessons we've gained from point-of-care testing, rapid diagnostics internationally are actually being used here at home. And it's just one more example of how our global health work is also of relevance to our domestic health priorities. I had the experience of working in Southern Africa as a clinician when HIV was first starting, when we had no diagnostic test. And yet we had streams of very sick and dying patients coming in one after the other. We also had blood that we didn't have the means to screen. So we were actually transfusing contaminated blood without our knowledge, but we didn't have any other choice. And not a lot of people remember the dark days when we didn't have diagnostics. If you fast forward now, 30 years, we have an incredible array of diagnostic tests, not just for HIV, but for other conditions that are very accurate. They're inexpensive. Many of them are less than $1. They give quick results. We can bring the test to the patient instead of always bringing the patient to the test or their sample, which can be very frustrating, can take many visits to get a result. And we can use easy techniques, a finger stick, an oral swab. I could test this room for HIV in 20 minutes if we were set up. I won't do that, but just that's where we are now. It's truly remarkable. And also, what's underappreciated is they're easy to store now. We don't necessarily rely on a cold chain for everything. The supply chain is actually one of the pieces to this puzzle that often breaks down and keeps us from delivering what we need to do in terms of diagnostics. So just to make the point that we've made great advances. Now here in the case of malaria, this is a sick child seeking care, and Todd already touched on this. In some instances, we at CDC do our own research and development, especially where we see the need. We see a gap in the technology, we see a gap in the diagnostics. So we've been working on a test called RealAmp. It's a molecular test for malaria. There are a lot of rapid tests out there. We're trying to seek perfection here. And this test, we do have perfection in terms of 100% sensitivity and specificity, which are the tests that determine accuracy. And we're in the process of working with industry to move this out to the field. But as Todd mentioned, when we began the President's Malaria Initiative now about a decade ago, the policy was presumptive treatment. If you had a headache or fever, you got malaria treatment, which was the right decision at the time because of the benefit that has on mortality. But of course, a lot of treatment was wasted. So now women, and especially pregnant women and young children who bear the brunt of malaria mortality can benefit from these diagnostic tests. And this saves money because now we're not giving drugs to those who don't need it. So our investments in better diagnostics will be cost-saving in the end, in addition to generating the impact, reduced mortality, morbidity that we're looking for. HIV testing has moved dramatically, and tests to quickly determine HIV status of men, women, and children have been developed, including not just the diagnostic aspect, but also whether patients are eligible for antiretroviral therapy. And I think you might have the test here, where you can do point-of-care testing around CD4 counts as well. It's a small battery-operated, battery-sized device there. It works all day on a battery, not requiring a direct current of electricity. It requires just a cartridge where you put the specimen in. It costs less than $2, and we can give the result that day to the patient and start them on life-saving antiretroviral therapy. So these kinds of advances have been dramatic. This is a rapid HIV test. It's a little faint, but this really revolutionized HIV testing. This is a positive where you see 2 lines, and this is a negative where you see one line. Very simple. And it also allowed us to move testing out of the laboratory to non-laboratory professionals, trained, but they could be lay providers, which also reduced cost, but also improved access at the same time. But this just doesn't happen automatically. It requires consensus building at the country level, requires validation in the country, convincing the country to adopt this technology. That's a big part that we play at the country level if we're not doing the research and development side, is working with a country to adapt these technologies and implement them in the field. And then once implemented, what impact does it have on patient care and mortality and overall impact on the epidemic? This is that's actually the South African health minister, Minister Motsoaledi, who said if a minister of health can do a TB test, anybody can do it. And this is a demonstration of the Gene Expert test. CDC's been proud to be a partner in this. This is a real success story of a public-private partnership where the Gates Foundation invested heavily in the R&D aspect. It was moved along by an NGO called FIND, which many of you may have heard about. It required partners like CDC and others to help validate it. And what we do is initially work in ideal circumstances, such as at the CDC laboratory in Atlanta, to first work with industry, evaluating their technology, then apply it to the field, do another round of evaluations, and then when we take it to scale, evaluate a third time. So this technology could diagnose tuberculosis within a matter of a couple of hours. If you look at the old way, which is still not irrelevant, the patient would cough into a cup, would bring it to the facility, would go back home, would cough into a cup a couple more times, would go back to the facility, would go home, would come back again. Maybe they'll get a result, maybe not. If it's positive, maybe they'll have to do a culture. That takes weeks. So this dramatically reduces those days, weeks, and months of frustration by the patient. And also, what we've observed with MDR-TB, multi-drug resistant TB, is it's taken months for them to ever get a diagnosis. Again, we can do this in hours and get them onto the right antiretroviral TB therapy. And the estimate is if we had incremental scale-up of Gene Expert in countries with high TB burdens, this would allow for the rapid diagnosis of an additional 700,000 cases of TB disease and save the health system dollars in terms of healthcare costs, some $18 million in direct healthcare costs. So again, diagnostics are not only life-saving, but also cost-effective in the end. So these were just a few examples of what I wanted to cover in terms of how diagnostics are really changing the face of global health. Reference was made to the World AIDS Day speech earlier this week, where the president announced the PEPFAR results of 6.7 million people being on antiretroviral therapy. That took a massive amount of diagnostic work to identify those patients, determine if they're eligible for antiretroviral therapy, and monitor them through the course of antiretroviral therapy. So diagnostics are really the foundation of much of our global health work. So thank you very much. Look forward to your questions.
Thanks, Tom. I actually had a recent trip with 4 health staff to southern Africa. We were in South Africa, down in KwaZulu-Natal, and we visited a clinic there that was using GeneXpert. And it not only identifies TB, it identifies drug-resistant TB and actually gives you the profile. It tells you what drugs that TB is resistant to, which allows the patient to get treated with the right drugs right away. Drug-resistant TB is a failure of good TB treatment, and it's really essential for the patient and for the community in which they live to get that treatment going right away and to have it proper. It's obviously a highly infectious disease. And it was amazing to me to see how quickly GeneXpert has been taken up. It really, in terms of a diagnostic capacity that was not around just a year or so ago, it is almost ubiquitous in many of the places around the world where you see a lot of TB. So it's the thirst for these diagnostics is actually quite tremendous, and it's great to see this kind of partnership. As an old Gates person, it's nice to see some of the stuff they invested in a while ago work its way through this system that Tom talked about, which gets to the CDC, find partners, get it out developed, and then get funders like the Global Fund and the U.S. government to get it in the hands of countries so they can use it for people.